So, good evening. I'm Rihanna Pineda. So, my objective for today is to provide bed bath to the patient. So, but first, let me review the medical records to validate if it's the correct patient. And next is I'll be providing all the necessary and special needs of the patient, such as the basin with the warm water temperature, the towel, the um, specialties such as the toothpaste, the shampoos, and etc. So now let's get started with performing an hand hygiene so that we can be able to start. So I'll be washing my hands thoroughly, and I'll be putting this alcohol base to sanitize my hand. And we'll be putting the gloves. Before we put the gloves, I forgot that I have to identify the patient first. So, ma'am, could you please state your name, your birthday? Okay. And then we'll be closing the door by privacy and the curtain. And we'll be again put a sanitizing alcohol. Then now we'll be ready to put our gloves. It is important to wear gloves to prevent contamination and other microorganisms for the safety of the patient. And now we are ready. So now we'll be putting the blanket or the towel to the patient on the top of the chest. To prevent soil of the water, and we're going to remove the gown of the patient, also covering her body to promote privacy of the patient. And we'll be going to put it on the laundry bag. And now we're going to proceed for the patient to touch the to test the water basin with water. So ma'am, could you test it if it's okay, temperature? Okay, thank you. And then now I'll be asking again for is the temperature aircon is enough for you? Okay. And now we'll be going to start for the face of the patient. So I will just soak this on the water. So we're not going to use any cleanser because it might irritate the patient's eye. So we will wipe it gently in the inner eye, outer eye, the nose, forehead, the inner ear, the neck, and we'll be going to hide it dry so that it will prevent chills to the patient. And next, we'll be going to move to the chest of the patient, so we'll be going to soak it again. And we'll be going to clean this area, the skin folds, especially on the chest, but we have to ask the permission of the patient. So is it okay for me not to wash your chest? Okay. So up to the umbilical cord and to the this area, then we let it dry. After we let it dry, we'll be going to proceed on the upper limbs, which is the arms of the patient. So we're going to expose only this area, but before that we'll be going to put put a towel so that it's much easier for me to not get soaked the bed. Okay, lightly slow manner, then we're going to let it dry. So don't forget the skin folds to clean this area because some bacteria might hide here. And then on the next area, so we're going to put it this here. And we're going to soak it again. So I forgot that we have to clean also the auxiliary area so that we will promote cleanliness to the patient. Yes, okay. Are you feeling cold? Oh, okay, not. Let it dry. Then next we'll be going to proceed to the patient's leg. So it's the same manner. Then we'll be going to expose it. So is it okay for me, ma'am, up to your private in the area? Okay, thank you. Don't forget the skin folds of the skin. And we're going to let it dry. Then next, for this other area, up to the inguinal, then we let it dry. And after that is earlier I have to acknowledge that before we do the certain things, I have to keep in mind that we have to remove the supplies of the patient and tell the patient if or ask the patient if she feels like she's about to go to the CR, so that we can avoid delay on our doing the bedbath. So now that we are finished, so I have to ask the patient to lie on the side. So could you please lie on the side now? In this side. So that I can give you a back massage. So once you're covering the area, you have to clean the back of the patient. But we have to refill first this water so that we can avoid contamination. Now that we finish the refill, we can, after I also finish hand washing and put our clean gloves again, so we can cleanse this area, the back of the patient, so that will promote cleanliness up to the buttocks area, because we wear gloves to avoid any fecal matter that will cause infection to the patient. And after that, we'll let it dry. So after we dry, we have to assess if there's any redness so that we can apply any ointment that will reduce and maintain the skin barrier of the patient. And the next is we'll be going to remove these gloves again, and we're going to skin hygiene or perform hand washing. Then we're going to back massage the patient, because in this manner it will improve the circulation, and because without gloves we can able to with or without gloves we can provide relaxation to the patient. And now we'll be going to reposition the patient, so you can now reposition in this area now. So now we'll be going to ask the patient, but before that we're going to put again another gloves. If the patient wants to clean her private part, or we have to assist her if she cannot able to do it, so we'll be going to put our gloves again. Okay, after we put our gloves, we can, is it okay for me to clean you po because of your, based on your condition po? Okay, so we'll be going to refill this again because we'll be going to clean her private part, which can prevent any infection into her inguinal area. So now, here's the clean water. So now we'll be going to soak it again. Towel. But still on the, we will lower the blanket. So I'll be clean it thoroughly po. Is it okay? Because some patients want to be independent, we can let them or ask them what's their preferences if they want to clean their private part. So after that, we let it dry. Okay. And then after we let it dry, we'll be going to provide the gowning for the patient. So before that, we're going to provide the gowning. So here's the gowning of the patient. So you can now wear this mat. Okay. After the patient already finished the gowning, we can remove our gloves. Hand hygiene, and proceed for the shampooing. Okay, ma'am, can you please put your head here on this side so that we can wash your hair? This side. So we'll be going to put this basin. Can you adjust your ano po? Kasi po hindi. So now we're going to proceed on patting or shampooing the patient's hair. So we have here the shampoo. So we have to make sure that the scalp of the patient, will massage them and clean thoroughly to remove all the debris or any dirt on the patient's hair, and then we pour it in water. After that, you have to dry it without clean towel. Okay, then we will reposition the client. Okay, you can now go back to your position. And then after that, so we're going to groom the patient's hair. To promote promote cleanliness and hygienic for the patients, okay? And provide relaxation also. And now we're going to proceed on the oral care. So can you open your mouth po? Say okay, then you're going to brush it, and we have water here. So can you pour it to your water? So just your wash, okay, thank you.